How good is the affordable healthcare insurance? Okay if it's for non-drug or surgery medicine, alternative medicine, but cheaper to educate yourself about health and disease and how to cure it, e.g. cayenne cures heart disease and that's cheap as cayenne pepper, and everyone I know of with cancer is curing it with cannabis oil, which is £20 a day, or a zapper is £100 for 3 months, about £1 a day, and lasts forever. Alzheimer's needs insurance to stop them taking your life savings, but don't take aluminium containing drugs and you won't get it. Arthritis cured with apple cider vinegar insurance. They all in on the orthodox medicine racket, as you can only get orthodox medicine on insurance, which is only designed to poison for profit, hence the worst medicine and the most expensive. It's like speech payments, the more it's propaganda or covert bunging, the more you get paid. They end up taking all your money even after death. Well over 50% of American bankruptcies are caused by hospital and medical bills. Yes, the hospital will take your home away from you if necessary to get their money, and even if you die, you still need to pay, and they will take everything from your spouse and children. I had numerous patients whose spouse underwent major medical treatment for cancer, and many experimental treatments, like bone marrow transplants, that were not covered by their insurance. Regular treatment or experimental, these patients racked up huge medical bills, beyond what their insurance would cover, and once their nest egg and life savings was gone, the bills kept piling up. Eventually the patient could not take the torture anymore and died. But when the patient died, the hospital and medical bills remained. You would think that if you die, that you would get a refund, or at least a pardon from the remainder of the bill, but this is not how the medical system works. I had many patients, who not only lost their husband, but also ended up having the house taken away from them by the bill collectors and courts from their unpaid medical bills. Since the name of the medical game was money, a means had to be devised to provide the patient with money that could only be used to pay for approved medical treatment. Enter the insurance company concept. Today employees have, as an important part of their remuneration for their work, a health insurance policy. This health insurance policy does not pay for all health-related needs, it only pays for those health-related services that are approved. These, of course, are the synthetic drug therapies that are known to work poorly, if at all. In order to secure effective medical treatment from the alternative sector of the economy, the patient must pay for it himself. Insurance companies specifically exclude virtually all alternative treatment. One wonders why so many continue to pay for an insurance program that cannot, even in principle, be of any real benefit to them. I always told my patients to please go to an oncologist. I knew a great number of them. And I would ask them to ask a couple of basic questions. Can you give me studies that show that what therapy you're recommending will improve my quality of life? They can't do it. Will you show me studies that if I take this, chemotherapy, radiation, whatever they're offering, can you show me a study that I will live longer than if I do nothing? There aren't any. If they can't provide documentation that your quality of life is going to get better or that you're going to live longer than doing nothing, why are you going to stay? Many of the cancer patients I saw were bankrupt. Their insurance would pay 80%, and they go, I'm covered, not realizing that the first chemotherapy treatment was going to be $30,000. And their 20% added up pretty quick, because there were 10 more chemotherapy on the horizon. An insurance company wouldn't cover his patients. Isn't it interesting? If you have coronary bypass surgery, it will be completely covered. $50,000, $60,000, not including your flowers, without a question. But if you want to have chelation therapy that over 1 million Americans have had successfully, that will reverse the actual cause of your disease, clear your arteries and help prevent stroke so that you're actually well, and it's non-toxic, and the whole treatment will run about $4,000. They don't want to cover that. Now, why don't they? Because, wouldn't it save them money? Wouldn't it be reasonable? Yes, until you realize that every one of these insurance companies has to honor the Medical Advisory Board. The Medical Advisory Board tells them which therapies are acceptable and which are not. To date, the gap or ignorance of FDA-approved drugs has created hypochondriacs. This can be seen by the fact that people now pay exorbitant amounts of money on health insurance their entire lives to ensure they have access to prescription drugs. Or, careers with paltry wages are rationalized by having health insurance as a benefit. In this case, health insurance acts as a Velcro package, sticking people to a false sense of security at the same time stripping them of their free will. Having health insurance to obtain prescription drugs is not a benefit, it is a liability. Simply because a poison is inexpensive via health insurance doesn't mean it is good for you. What affordable healthcare insurance? Do you know something we all DNA know about? The only thing close is a low fixed-cost monthly medical membership called Direct Primary Care. Comprehensive primary care. Not major medical. No surgeries. No hospitalizations. No copays. No deductibles. Available in many states and top 50 cities. ACA insurance is great in general as it covers all 10 of the essential health benefits. The biggest challenges people find in general are narrow networks, preferred doctor or hospital in the network, and affordability if you do not qualify for a subsidy.